if you have spent even a little time in the fitness, longevity, biohacking, or anti-aging world, you have probably heard people talking about peptides. And some people call them the future of medicine, and others call them the next revolution in the fitness and recovery. And then there are people claiming that, peptides can help with everything from fat loss to muscle growth to injury recovery to sleep to brain function, sex, and even healthy aging. But what exactly are peptides? Which ones are actually worth knowing about or you should be using? And more importantly, which peptides are backed by science and which ones might be overhyped? So today I'm going to walk you through 20 of the most important peptides which are currently being discussed mostly in the world of fitness, performance, recovery, longevity, anti-aging, regenerative medicines, biohacking, etc. See, ever since I have recovered from my cancer treatment and that journey, I started learning about peptides, and I'm now helping a lot of people also with respect to this. So let's start understanding this, and let's start with the category that gets the most attention at this point of time, that is fat loss. Now, when we talk about fat loss peptides, we talk about semaglutide, we talk about tirzepatide, and the third one is the most important one, which is acting, going with the three receptors, that is retatrutide. Now, starting with semaglutide, see, that's the basic one, right? That changed the entire obesity industry. That is semaglutide. It works by activating GLP-1 receptors. So in simple terms, it makes you feel fuller and longer, right? So for full, you feel like your stomach is full for quite long time. Now, when that happens, what will happen? Automatically, you eat less food and you experience fewer cravings, and the food noise will come down. You don't eat unnecessary things. Even the necessary things also you stop eating, and your insulin sensitivity also improve. And that's why many people lose significant amount of weight when you're using it. But it is not that perfect. The most common complaints that I have seen with semaglutide is nausea, constipation, bloating, digestive discomfort. And for many people, the benefits are actually less compared to the side effects. In fact, the cost benefit analysis, if you look at it, it's not that favorable for many people. But for some of the people, it works very beautifully also. But it's very important to understand that semaglutide work primarily by reducing the appetite. Your hunger is reduced, so the food noise is reduced. No other functions. Now comes tirzepatide. That's like a step ahead. It's a next revolution. Instead of activating only GLP-1 receptors or working on hunger or appetite, tirzepatide activates both GLP-1 and GIP. So here is a dual mechanism, and that actually produce greater weight loss than semaglutide. And many users also, reported better tolerability also. And researchers believe GIP may help to improve insulin sensitivity and reduce some of the gastrointestinal side effects which are associated with GLP-1 drugs. So that is why tirzepatide has become one of the most talked about weight loss peptides in the world. So this is what first one we have seen, GLP-1. Now we are seeing GLP-1 and GIP. So Ozempic is the first one that you are familiar with, and this is Mounjaro. Now comes to the third one, that is retatrutide. This is another step, right? So we move into what may be the most exciting obesity drug currently, which is under investigation. Still, the trials are going on. So that is retatrutide. Now, retatrutide activates three receptors. GLP-1, of course, like semaglutide, then GIP, like tirzepatide, GLP-1 and GIP. Now here glucagon receptors also, and this makes it a triple agonist. So what makes glucagon interesting is that it may increase energy expenditure and fat burning. And most weight loss drugs simply reduce appetite, if you see. So GLP-1 is basically working on appetite. Then comes GIP, insulin sensitivity also, but here energy expenditure, that also managed. So retatrutide may reduce appetite, at the same time increase the calorie burning simultaneously. And there are studies which have shown a weight loss of 25%, those who are using retatrutide in a short span of time. So three receptors, triple agonist, GLP-1, GIP, and glucagon. And that's why many researchers believe that retatrutide may represent the future of obesity treatment. Now comes the next category. That is, again, a fat loss one, but not that effective as retatrutide, AOD 9604. It's a fragment. It is also known as fragment derived from the human growth hormone. So it was developed specifically to target fat metabolism without many of the growth promoting effects which are associated with full growth hormone. So if you see, full growth hormone is this, one of the function of growth hormone is fat loss, right? And that fragment of growth hormone is taken, and that is what AOD 9604. So here it is about, that targeting that fat metabolism. And so there are studies which are suggesting huge benefit of fat loss when it comes to this. And there are other studies which are showing limited result also. But if you look at the evidence, it actually remains mixed. And this is one of the peptide where, in fact, enthusiasm often exceeds the quality of the data. But if you look at Retatrutide, then there is no question about that. Just that it is not, accepted by FDA. Now comes Tesamorelin. Tesamorelin is one of the most effective peptides for reducing the visceral fat. And visceral fat is actually dangerous fat which is surrounding the internal organ. See, unlike regular body fat, visceral fat is strongly associated with your insulin resistance, the cardiovascular diseases. Now, Tesamorelin is FDA approved for reducing excess visceral fat in patients with HIV-associated lipodystrophy. Now, coming to the next category, that is healing and recovery peptides. That's the most popular categories among the bodybuilders also. And first and most important one, that is BPC 157. If there is a celebrity among peptides, it is probably BPC 157. So BPC stands for body protection compound, and it is often discussed for tendon healing, ligament recovery, muscle injuries, gut health, and many athletes and fitness enthusiasts swear by it. Animal studies are extremely promising. Human data, of course, is still limited, but there are evidences that it is helping in all these. So multiple functions, tendon healing, ligament recovery, muscle injuries, gut health, and everything. But BPC 157 again remain one of the most talked about peptide in the world. Its human data is still limited. Then along with BPC, normally you use TB500, right? So when BPC is often described as a local repair peptide, TB500 is viewed as more systemic recovery peptide. It is associated with the tissue repair, injury recovery, wound healing, mobility improvement, etc. And many people, I have seen, me also, my friends also, my clients also, they combine BPC 157 and TB500 for the recovery protocol. Very, very good for, workouts and recovery after workouts, etc. Now comes KPV. KPV is a small peptide fragment that is actually derived from alpha MSH. It's primarily, based on, or its main interest comes from its anti-inflammatory properties. So the body have some inflammation, so it will be taken care. So researchers are investigating KPV basically for inflammatory bowel disease, gut inflammation, and immune regulation. And this is again one of the most interesting gut health peptide which is currently being studied. Then TA1, Thymosin Alpha-1, and this peptide focuses on immune function. It has again been studied for immune regulation, infection resistance, and inflammation control. See, unlike many peptides which are aimed at aesthetic or performances, thymosin alpha is focused on optimizing your immune system activity. Okay, now let's look at the next category, that is muscle building and performance peptides. First one, CJC 1295 and Ipamorelin. See, these two are again used together, just like I told you, BPC 157 and TB 500. So here CJC 1295 and Ipamorelin, that's used together because they work synergetically. So they stimulate natural growth hormone release, and this can potentially improve your recovery, your lean muscle growth, your sleep quality, and your performance. So see, unlike injecting growth hormone directly, that there you're injecting GH growth hormone directly, but here these peptides are actually encouraging your body to produce more of its own growth hormone. Yes, of course, it may take time compared to the actual growth hormone which you are externally injecting, but here your body is producing the growth hormone. Now comes the next one, which is again the best, one of the best one, that is MOTSC. One of the most fascinating peptide in the longevity science. MOTSC is produced within your mitochondria. Remember, mitochondria are the power plants of your cell. And here, the investigation for MOTSC is for energy production, endurance, metabolic health, and healthy aging. And scientists believe it may become one of the most important longevity peptides in the future. Next is IGF-1 LR3. This is not a beginner peptide. IGF-1 LR3 is a long-acting form of insulin-like growth factor, IGF, and it is associated with your muscle growth, your recovery, and anabolic effects. But it is also carrying significantly greater risk compared to many other peptides. And this is definitely not a casual experimentation compound. This is for like advanced bodybuilders like that. Now comes again one of the famous in the longevity community, Epitalon. So it is again associated with melatonin production, sleep quality, circadian rhythm regulation, and healthy aging research. So there are studies which suggest possible effects of telomeres, and although again more research is of course required, but regardless of all that, Epitalon remains one of the most widely discussed anti-aging peptide at this point of time. Now comes again the favorite ones, brain peptides. This is for cognitive performance, Selank and Cmax. Selank is often described as an anti-anxiety peptide, and many users actually report improved calmness, reduced anxiety, better mental clarity, and some people have experienced remarkable benefits. But of course, there are other people who notice very less also. Again, responses to Selank depending upon individual. Next, again in this category, Cmax. Cmax is often discussed as a nootropic peptide. So it is again associated with your focus, your attention, your cognitive performance, and mental stamina. And some users have described it as providing noticeable improvement in concentration and productivity. Then comes again one of the favorite, that is related to skin and hair peptide, GHKCU. So it's a copper peptide, and this is one of the most researched peptide for your skin quality, collagen production, wound healing, hair support, elastin production, and most of the strongest evidence exists for the topical use, and there are creams and there are serums and all those for external use. Internal, it is of course not yet approved by FDA. That's why creams and serums containing GHKCU have become increasingly popular these days. Now comes to libido and hormone peptides. Like first one, PT141. It differently works from most other libido products, right? So see, instead of working directly on blood flow, for example, you take Viagra, that works on your blood flow and increase your blood flow. But here, that's not the case. Here, PT141 works within the brain, and it is associated with increased libido, sexual desire, and arousal pathways. But nausea is one of the commonly reported side effects for this. Now coming to melanotan, right? In melanotan 2. Melanotan 2, in fact, stimulate melanin production as its name indicate, and it makes the skin tan more, brighter. It increases the tan, right? So some users have reported that dramatic tanning effect also, but there are concerns which are remaining regarding the changes in moles and skin pigmentation. So anyone considering this peptide should be extremely cautious. Then the next one is Kisspeptin 10. This is one of the most interesting reproductive peptide. So Kisspeptin stimulate the release of GnRH, and this after that stimulates LH and FSH, which basically influence your testosterone production, your sperm production, ovulation, fertility. And because of this, Kisspeptin has become one of the major area of fertility research. So see, after hearing all of these, it's very easy to become excited, right? But the reality is, peptides are not magic. Now, peptides can compensate for poor sleep or bad nutrition, lack of exercise, chronic stress or obesity or metabolic dysfunction. In fact, the people who get the best result from peptides are usually the people who already have their lifestyle properly dialed in. They train consistently, they eat well, and they prioritize sleep, and they in fact use peptides as an additional tool just for support. So it's not a shortcut. So the peptide world is evolving incredibly faster. And today we have peptides which are being researched for every purpose: fat loss to recovery to muscle growth, immune support, cognition, fertility, longevity, and everything. Some have strong evidence and some have promising early research also. And some are still surrounded by more hype beyond science. So the key is understanding that peptides are tools. And like any other powerful tool, they should be approached with respect, caution, and solid understanding of both benefits and the risk. And if you want any help for the use of peptides or understanding peptides or to learn about this, you can get in touch with us. We help to plan your use also, your understanding also, because the goal is not simply to take peptides. The goal is to build a stronger, healthier, and more resilient body that performs well for decades to come. And that journey that always start with the fundamentals. Train hard, sleep well, eat intelligently, and manage your stress. You know, if appropriate use you are doing, if you're using it properly, appropriately, then if you're using these tools wisely, then you will be able to do that very well. So that's about this session. Thank you so much. I see you in the next video.